Good morning, all. Today, let us have uh, a brief idea about a topic which is called KMC. You all know KMC in the sense Gangaru Mother Care. Uh, it is especially given to the child or a newborn, okay, newborn who is very preterm and has low birth weight by nature. When the baby is born more than 2.5 kg, it is said to be a normal Indian baby weight. But when it is less than 2.5 kg, the child has difficulty to maintain normal thermoregulation. So the child may go for hypothermia and it may lead to several complications. So as like how Gangaru cares its baby in a pouch, the mother will be carrying the baby in between her breast until the baby uh, maintains with normal body weight. And the definition of Gangaru mother care, it is a special way of carrying low birth weight baby by skin to skin contact. Okay, we'll see how which mother is eligible to give Gangaru mother care, and what are the prerequisites for Gangaru mother care, what may be the eligible criteria, and who all are, can give Gangaru mother care if the mother is not physically fit. Okay, one by one we'll see. Now let us see the components of KMC. So there is three components. The mother has to maintain skin to skin contact with the baby, and there will be exclusive breastfeeding for adequate nutrition and desired weight gain until the period of KMC. And the baby has to be discharged earlier from the hospital to prevent nosocomial infection. So we used to discharge the baby when the baby comes with an ideal weight. So we'll wait until that for a discharge. So these three components are mainly in KMC. Prerequisites, if you see, the support to the mother by counseling and counseling to the family members also, because some of the family members will not be allowing to the mother to continue with these kind of practices, because they will not be having adequate education about KMC. And post discharge and follow up, the mother and the baby should be followed up by every week by the ASHA worker or the workers who are in the healthcare department. And training of nurses, the nurse who are going to give um, uh, Gangaru mother care to the Gangaru mother care to the mother and baby should be properly trained about all the information and the method of giving Gangaru mother care, and educational materials to be provided to the mother regarding when it can be started, when it should be stopped, when it has to be continued, what are the things um, can be avoided during KMC. And reclining chairs and beds with adjustable backrest must be provided to the mother before the KMC. And mother's clothing should be front open, it should be light dressed, and as per her local culture she can follow. Here in our districts and states, we are following with nighties, so that can also night wears, that can be worn by the mother. And baby's cloth also should be front open, sleeved shirt, and baby should have cap, socks, mittens, and diapers. And mothers should be encouraged to ask questions to remove anxieties. Pre-demonstration of the procedure by the trainees must be given, and privacy strictly to be provided. And benefits of KMC, we have several number of benefits. It provides thermal control. The first initial benefit is it provides thermal control, so we can prevent hypothermia. And mother-infant bonding will be increasing, and continuous increased duration of breastfeeding, we can expect yearly weight gain, and its satisfactory satisfies all the five senses. So the baby can hear mother's heartbeats. Baby can feel the smell of breast milk so her mother, and touch sensation occurs by skin to skin contact and protects against nosocomial infection, does not require any additional stuff. Once it is trained with the mother does not need any adequate members to continue with the um, KMC. And time of initiation of KMC as soon as the baby is stable in NICU can be given at any time of ongoing any medical intervention such as IV fluid administration, O2 therapy, or garbage feeding. And eligibility criteria: low birth weight baby, the baby less than 2.5 kg, and the baby who was hemodynamically stable, the vital signs, and the baby should be free from all infections, maternal infections, and baby should maintain normal breathing rate, heart rate, and so on. Transportation of sick neonates to proper facility from hospital, and if there is any issue, we are not able to deal with a low birth weight baby, we should have a proper transportation facility to transfer the baby from the from one hospital to the facilitator hospital. And the baby's weight should be should be less than 1000 uh, 200 gram with serious prematurity. And baby who receives tube feeding and O2 therapy also can be given with KMC. And for mother, all mothers can provide irrespective of age, education, religion, and culture, free of serious illness. The mother should not have any serious illness like severe hypertension or seizure disorders, or a severe form of any disorders. Willingness to mother should have willingness to provide KMC first of all, and she should have good hygiene, regular bathing, and short and clean fingers. So this is the image we can see. The baby is receiving O2, and at the same time baby is having IV fluids therapy, and the mother is providing with the KMC. The skin to skin contact is there, and the father is also can provide KMC. And KMC procedure: the baby should be placed between the mother's chest in an upright position. Okay, the baby's head to be turned towards one side, because meanwhile the baby can receive breastfeeding, and baby's hips should be flexed and abducted like a frog-like position, and arms should be flexed, placed over the mother's chest, and baby's abdomen should be placed over mother's epigastrium. And baby monitor baby for airway, breathing, color, temperature, and mother needs to give breastfeed or feed with palatai spoon, or tube feeding can be also upon the baby's disease condition. And duration should not be less than 1 hour. It should be continued up to 24 hours, even until the mother is telling about any physical complaints. An interruption only can be done for changing the diaper. When the mother is not available, the family members also can provide KMC. Discharge criteria: the baby should not have any apnea. There should be general good health, and the baby should get adequate feeding, no infection. The gaining of weight should taken place between 15 to 20 kg per day, and normal body temperature and confidence level of the mother. She should give assurance that after the discharge she will be able to take care of the baby without any staffs and assistance of any staffs. And discontinuation of KMC: when the baby becomes the weight around 2500, we can discontinue the procedure. And when the baby reached 40 weeks of post conception age, we can discontinue. And if the baby shows discomfort, if cries often, fuzzes every time, and sleeps well in supine position, we can discontinue with the KMC. And post discharge and follow up, the baby should be followed up until it reaches 2.5 kg, and follow every 2 to 4 weeks is necessary for until it becomes